We begin tonight in Hattiesburg, where some of the region's top doctors are discussing crisis contingency plans. Fox 23's Jaclyn Coleman tells us what the University of Mississippi Medical Center is bracing for as COVID cases continue to climb.
The University of Mississippi Medical Center has in place the contingency standards of care. If things escalate from the virus, crisis standards is the next step.
There is a limit to the resources that we have available. And based on what we're seeing right now, we will get to a point where that limit is hit.
And space isn't their biggest problem.
I think if anything gets us into a situation where we would have to stop or cry uncle in providing care, if we ever got to that point, it would be due to staffing shortages, particularly nurses and nursing assistants.
But there's something making the issue worse.
We had a meeting earlier today and learned that some of the staffing agencies that are placing nurses all around the country right now are offering, numbers like $150 to $200 an hour for a nurse.
A COVID system of care was activated statewide this month, requiring hospitals to accept transfers on a rotational basis. That's something UMMC says is helping level out the demand.
To help coordinate over 500 patients move within the systems, MedCom has a rotation where we will send the patient. We try to keep them as close as we can to the sending facility, but we basically do a round robin of where we send patients that need ICU level care to hospitals that have intensive care units, even though everybody's full.
Health officials are hoping the vaccine distribution will get the state under control. For example, the hospital is discussing what to do if it reaches a point of the standards of care plan. That can mean a change in the ratio of nurses to patients. In Hattiesburg, I'm Jaclyn Coleman.